Myofascial release for the upper back and shoulders. Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practititioner. Today I want to show just a couple ways that you can release your body in the upper back and your shoulders. So you might need this technique if maybe you have neck pain or you get headaches. Possibly, maybe you know that you're tight into your shoulders. Maybe you're a mom that breastfeeds and you're doing a lot of this coming forward or holding baby. And maybe you're just having some back pain up into your shoulder blades or down even into your lower back. So this is a good release to do at home, and you need very little equipment. For this technique today, all you're going to need is a small ball. Now, I have a couple of versions, and I'm going to show you the coregeous ball. It's a really nice ball that I got from Amazon, and it's actually adjustable, which I'll show you that in a little bit. Otherwise, you can use a small inflatable ball like this. And here at the Healing Spot, we give all of our new patients one of these balls, and it's a really great self-care tool to do some myofascial release. So perhaps if you're a patient of ours, you already have one of these. If you don't have a ball like this, you can certainly go out and purchase one, or you could even use a rolled up towel roll. And I'm not going to show that, but basically what we want to do is kind of lift up the upper back, and you're going to see that here in a little bit. And you can certainly use a towel roll at home in a pinch. Okay, so I'm going to show you two techniques. The first one we're going to do lying down on the floor. All right, first I'm going to explain a little bit about this coregeous ball that I really like. You can tell it's deflated and you might think, well, what's wrong with it? There's actually nothing wrong with it. It's just adjustable. It comes with this little plug and you can take it out, and it also comes with a little plastic straw. So you can blow it up and you can make this big, but I've deflated this and I want to show you why. I want it to only be this tall. I don't want it to be really blown up because that would be too aggressive for what I'm going for. Alternatively, you could use this small ball here, but let me show you. I'm going to put this down on my mat, and what I'm going to do is place this into my upper back. I want to land kind of into my upper back between the shoulder blades or just a little bit higher. So you can see here how when I'm now lying down, it's really allowing my thoracic spine here, the middle of my back and upper back, to extend a little bit. And what it's going to do is going to lift me up. So now when I bring my arms out to the side, you're going to see that I can start to feel stretch along the front of my shoulders. Now, of course, you could use this little ball pretty much in the same spot. It's just this isn't adjustable and it's a little firm. So I like the coregeous ball because it actually distributes my weight and pressure a little more evenly, and it feels better than that small ball. Regardless, here you can either keep your knees bent if you have a lot of tightness and this is an aggressive stretch for you. You can either let out some air in your coregeous ball, or you can keep your knees bent. That way you're not clear down like this and really arching. Okay, so use your legs however you feel like you need to. From there, we're just going to bring hands, palms up. And what I want you to imagine now is that there's kind of a string going from the middle of your chest out through your shoulders, out through your arms, and through your fingers. And what you want to do is kind of lengthen out through your hands, and then just gently soften down and allow yourself to drape over the ball. And you're going to be here. To do a myofascial release, you actually want to hold 3 to 5 minutes in that position. If you don't hold long enough, you're really not getting into the fascia or the connective tissue of your body. Fascia covers all structures of your body, not just the muscles and the skin, but also your bones and your blood vessels and your nerves. And so what we want to do is allow that fascia or connective tissue to really let go and soften. And what that's going to do is give you a little bit more permanent changes in your body. Instead of just doing a quick stretch for 30 seconds or so, that's really only targeting the muscle, and you're not going to get long-lasting results from that. So with that, go ahead and you can, again, hold for 3 to 5 minutes. The other thing with that, another tip is when you come down onto the ball, you can choose where your arms are. So if you're really, really tight here, What I would suggest is maybe keep your arms down a little lower. So instead of being out into a T, maybe you need to be into a low V position. And that might be enough of a stretch for you. Okay. Alternatively, if this isn't enough for you or you want to play around with it a little bit more, you can bring arms up into like a Y position. So a little higher overhead. And that's going to help to get into different parts of your pec muscles here into the front of your shoulders. Now, a lot of times I recommend this to patients because they're tight. When we try to do things like low pressure fitness training or we try to do pelvic floor and core strengthening, and I'm trying to get them in a neutral position, I find that a lot of people are tight. Their shoulders are pulled forward, okay? They're tight here in the front of their shoulders and their chest. And so this is a good one to help not only relieve some discomfort, but to allow your body to actually have the mobility it needs. So for that reason, I want to go back to when we started this video. I said this might be something if you have headaches or you have neck pain, why this might help. Even though we're not doing anything with the neck, a lot of times when we have tightness in here, it's pulling the head forward, it's pulling the shoulders forward, and it's straining into the back of the neck, causing headaches. Or you might even feel that in between your shoulder blades into your upper back. Okay, so this is a great one for that. And also for your lower back, because we're working at the upper part of the back, but your spine is all connected. So give that a try. And we're going to move then to the second way to release your upper back. For the second release that you can do, you're going to want the small inflatable ball. And I would recommend that you use an inflatable ball instead of a ball like a Nerf ball or something that's going to kind of collapse underneath the pressure of your body. What we're going to do is we're going to actually place the ball into the front of the shoulder. And you can do this, obviously, one side and then the other side. You're not going to be able to get both sides at the same time unless you happen to have two balls. What we're going to do, I'm going to show you this on the floor, but here in a little bit, I'm going to also show you an alternative position to do this. So I'm going to be here on the floor. I'm going to come down onto my stomach. And what I'm going to want to do is place this ball into the front of my shoulder, into those pec muscles, okay? Not in the armpit, but a little bit more towards the front. I'm going to come down. I'm going to bring my arm out to the side. And now what I can do is rest my body and allow it to drape over the ball in this position. Now, you can have hand here in any position, just like you were on your stomach. And what I would recommend is to lie down, put the one hand underneath your forehead, basically, and lie like this. I'm not going to do that because it makes the audio kind of weird on this video. But you can do that straight out, okay, if you have this mobility. Not everybody has the mobility or can't get onto their stomach, so I get that. This can be done, I will say really quick, can be done on a bed with your arm hanging over the edge. So if you can imagine me lying down on my stomach, arm is hanging down, fingertips pointing down along the side of the bed, and hand pointing towards the floor. So you can do that. And then I'm going to show you one variation of this in standing. So the alternative position would be in standing. And what I would recommend is to get in a door frame. So I like this. I'm going to show you on my right side. I like having the door open because if maybe you're pregnant and you can't get onto your stomach and you have baby, here, this really protects your body, but it also helps just get into a better position if you can't get onto your stomach. So what you're going to do here is place the ball again onto the front of your shoulder. And what you can do then is lean up against the wall or the door frame with your arm at any angle that you choose here. And what I can do then is just really lean my body into the ball and wait for it to soften and let go. So that's the second way that you can release your upper back and shoulders. So remember, I just want to emphasize, you want to hold for a minimum of 3 minutes, but ideally 5 minutes or more so that we're getting a true myofascial release. Okay, so give those a try and I hope that they help you. I do want to finish this video by saying there's a lot of reasons that you might be having headaches or tightness or tension, pain into your upper back, any of those. And using these techniques, I hope it helps you, but if it doesn't, don't be discouraged because there can be a lot of reasons for that. And maybe you need more of a customized approach, a customized plan to feel better. And in that case, we would be more than happy to help you. You can reach out to us here at the Healing Spot. Head to our website, healingspotpt.com, and pick whatever option works out the best for you. You can talk to a member of our team, get all of your questions answered, and find out what the next best step is. It might be sitting down with one of our therapists for a free discovery session and finding out exactly that customized plan of care that will help you feel better, feel more mobile, and just live life to the fullest. Thank you for watching this Ed Talk. We will see you on the next one.